Recognizing the member from Vernon-Monashee.
Thank you, Madam Speaker. Today I rise in this House to wish a very happy Nurses Week to all the incredible nurses. Nurses in British Columbia play a critical and integral part in our healthcare system. We cannot imagine the healthcare system without nurses. We know the past few years have been some of the most difficult on record for nurses and healthcare workers in this province, and yet they stood with us, stood for us, and continue to lead with a commitment for quality healthcare for every person in this province. Nurses and healthcare workers embody the values of resiliency and public service. Their contributions over the course of COVID-19 pandemic were critical to preserving the integrity of our healthcare system and guaranteeing the health and safety of British Columbians. We all owe a debt of gratitude for their past, present, and future contributions. There is not a day when I don't appreciate and think of nurses with so much gratitude, Madam Speaker. Nursing and healthcare are a huge part of my own identity, passion, and pride. While I stand today in this House to wish all the nurses Happy Nurses Week, I want to let you all know that we see you, we hear you, and our BC-NDP government is working hard to add resources and supports in healthcare to make your workplaces better and safer, and to fill many existing gaps. Some of the steps our government has taken so far: we invested $96 million in 2021 to support our healthcare workforce. We have been making investments, expanding support, training, and opportunities for nurses. Between 2017 and 2020, there was an overall 6% increase in registered nurses and 12% increase in the licensed practical nurses. This is a result of making forward-thinking investments in public health care. This greatly helped us in meeting the demands of COVID-19. In April, we doubled the number of new nursing seats at the post-secondary institutions across the province. 17 post-secondary institutions across the province received a combined 602 new nursing seats, in addition to the previously added 2,000 seats, providing more opportunities for the next generation of nurses to learn and practice close to home. Our government remains committed to expanding high-quality public and universal health care. We will continue to make the right investments in our system and people at its heart. Increasing our supply of world-class nurses represent a key component in a broad-based strategy to our healthcare and healthcare workforce. We also know that there are internationally trained nurses in BC and around the world who dream of serving patients across the healthcare system here in British Columbia. I am an internationally trained nurse myself, and I have gone through the lengthy, cumbersome, and very discouraging process myself. We had no supports in place at the time, none from the government of the day or from union at the time. I remember making several calls and driving distances to see if there was a support or guidance. Despite being trained from a great institute with excellent grades and more than triple clinical hours than needed to become RN in BC, it took myself and many other internationally educated nurses many years and hardship to become RNs here. The province is supporting internationally educated nurses who wish to work in BC by investing $12 million by consolidating the provincial-based assessment process for internationally educated nurse candidates. Part of this investment, approximately $9 million, will go into bursaries to help with English language test fees, assessment fees, and transitional education supports. And we're creating new nurse navigator positions to help internationally educated nurses navigate the assessment, licensing, and employment process. By streamlining the assessment process and removing some financial barriers, internationally educated nurses will be able to enter workforce sooner and more easily. And British Columbians will have access to even more nurses to support the healthcare needs. In addition, Year 2 of surgical renewal delivers completion of training by health authorities of an additional 400 perioperative nurses and 100 medical device reprocessing technicians. We have created 200 new nurse practitioner positions to support patients as part of a shift to team-based primary healthcare system. We have invested in expansion of LPN access program for 2020-2021 at North Island College and the Nicola Valley Institute of Technology to enable more healthcare aides to become LPNs, and LPNs to RN bridging program at Vancouver Community College and Thompson Rivers University. Our government acknowledges the challenges that nurses face across the province and are actively working collaboratively with key partners towards effective, immediate, and long-term solutions that address workplace violence and create a safer work environment for all healthcare providers, and enable best practices to attract, recruit, and retain nurses all across healthcare sectors in BC. We know that nurses have made an unwavering commitment to every person in this province. Our message is to you is we hear you, we see you, and we are taking every step we can to make things easier in the future. I also want to thank the BCNU executives and their representatives. I've seen their activism over the years, how they make sure that nurses all across the province have safer and better workplaces. And I really applaud their ongoing activism and efforts that they do and the work that they do there. At the end, I would say the things I've highlighted are some of the things we're undertaking. There is more work that's being done, and that may not bring comfort to you as the working situations and the workload issues are quite unbearable at the moment, given the two health emergency, opioid crisis, and then pandemic. But I would like to reassure you that you have two of us here advocating on your behalf every single day. And happy Nurses Week, and thank you from the bottom of my heart on behalf of our BC NDP government and all the members of this House. Thank you for all you do.